We have returned from recess. My colleagues, reminder, any amendments to increase or decrease, please make sure that you submit all your amendments to the core, and every one of our colleagues have a copy. And ensure also that the identification of where you're getting the funds from or taking the funds from is identified. We are now on page 4. Do we have any questions for page 4? Page 4. Yes. Identifies all the different special funds. Do we have any questions for page 4? Senator Lee?
Mr. Chair, I just had a clarifying question for its letter X, so that's line 13 on page 4, the Office of Vital Statistics Revolving Fund. In my copy as amended, it shows a red line on that. Was that something that we included after the introduced bill? Or I just want to know kind of the timing and why it's redlined in my copy.
You have a red line on your copy?
Yeah, so I'm looking at Bill 186 as amended by the committee, but the bill online, I just want to know when letter X, the Office of Vital Statistics Revolving Fund, $238,000 was added. Was it an omission in the bill as introduced, or is there a reason why it's redlined?
Yes, Senator. What we did is we just went back and put the fund in alphabetical order. So if you notice that it was under O, but if you go back to I, page 5, that's all it was. No additional funds. It's just to put it in the proper alphabetical order.
Mrs. Masi. And can you also talk to us a little bit about the increase in Healthy Futures Fund? That's letter Q. So it went from, I believe, the budget bill as introduced, it was 37.6, and now we're at 41.5. So can I just have the rationale behind the bump up?
Yes, Senator. The Healthy Future Fund actually was increased by 3.8 million, and that was based on the original projection based on the average of FY 2019 and the average over the last 3 fiscal years. However, over the last 3 fiscal years, the audit didn't reflect the increase in the tobacco tax. So what we did is we went ahead and made the adjustment to show that increase. Thank you.
Thank you very much, Mr. Chair. Mrs. Masi.
Thank you. Any other questions? Senator Therese, you have a question?
No, could you just clarify that again? How did the audit not show the increase in tobacco tax? When did that take place?
I believe the tobacco tax went into effect, I think, the beginning of fiscal year 2019.
Okay, any other questions for my colleague, Senator Muñoz?
I think I've been reserving my time just for this point. So first of all, Mr. Chairman, I just want to ask, thank you very much. Good morning to you, by the way. I just want to ask, so there are sections in the bill, under appropriations in the back that may or may not affect some questions that I'm going to ask you today. So do I have to start by bookmarking all of those, or should I we just go along? I just want to make sure that I understand
We're only on
correctly.
page 4 on the revenue.
Okay.
If you want to question the revenue, the basis of the revenue listed,
Okay.
then that's when you want to question. But as we move along to the bill, I know that you're going to have questions that relates to Healthy Future Funds.
Okay.
But it won't, more than likely, throughout the bill, it won't
Affect
be the
the-
question of
won't
the
affect
revenue, but it'll be the amount that's in those agencies, and I think that's what you're concerned with.
Okay.
Okay.
I actually do have something to pass out for the body here. I had it copied last week, Friday.
Okay,
So I'm not sure, maybe if you want to go to the next speaker, and then I'll just,
All
I'll
right.
have them pass it out.
Does any other colleague would like to ask questions? Senator Amanda?
Thank you, Mr. Chair. Thank you again to the panel for joining us for another week. I have a question about letter Q, Healthy Futures Fund. Originally, in your first bill, Bill 186, it was projected for $37.6 million, and now in this amended version, we have a projection of $41.5 million. And I see in the Healthy Futures Fund projection for September, it's projecting at $6 million compared to an average of $2 to $3 million for every other month. So maybe you can just explain what's this jump for September, and if that's correct.
Are you referring to September this year or September of last year?
September 2019.
Okay, remember, what we did is, in 2019, the projection for the Healthy Future Fund did not include the adjustment in the tobacco tax that took effect October 1st of 2018 for fiscal year 2019.
Okay.
So that's why you see an adjustment in the month-to-month projection, simply because we went ahead and considered that increase in the tobacco tax.
Okay, but only to see it between August and September for that to be a $4 million jump?
I would have, let me refer to our projection here before I answer your question. Senator Amanda, I think Jason Mark can be able to
Okay.
help me on this one.
Thanks, Jay.
Hi, good morning, Senator. The reason why the September projection is at the 6 million amount is usually the last month of the fiscal year. Majority, there's a influx of revenues, and because the accounts don't close until November or December, some of these revenues are booked at the end of September. So it's recorded as a collection in September per the AS 400. So that's why a majority of those bookings are recorded in that month. In previous fiscal years, it's showing the same. And this is also reflective of the increased tobacco taxes that started this year as well.
Okay, thank you very much.
Any other questions from my colleagues before I go back to Senator Moon? Senator Therese?
On page 4, right?
Yeah, we're still on page 4.
Yeah, just so the Healthy Futures Fund, it looks like for 2019, what you predicted was 41419,667, and so this prediction for 2020, I'm looking at the Special Revenue Fund tracking report. Well, anyways, Public Law 34-116, right? So predicted 41419,667 for 2019. You're tracking 40. And so this prediction for 41,517, it's $1 million over what you're tracking for 2019, right?
You're trying to compare 2019 and what we're projecting for
Correct.
2020? There's
Yes.
only, there's less than that, but speak.
Oh.
Yeah, just Senator, just keep in mind that tobacco tax actually went into effect fiscal year 2019.
Right.
So what we're doing is when we looked at the tracking, we went ahead and used historical data. We also considered, what would occur in this fiscal year, which is not part of the tracking of the last couple of years. So we went ahead and made an adjustment, feeling that this is what the $1 million is something that we might be able to accomplish and materialize at the end of the fiscal year.
Right. So we've already predicted that the impact of the increased tobacco taxes for 2019, right? That was incorporated in Public Law 34-116. So we predicted revenue to be 41 million for the Healthy Futures. According to your report, you're tracking 40 million, but we're still confident that for 2020, we're going to get $1 million over what we're tracking now. The only reason I'm asking is because, of course, all the health agencies that are funded and programs that are funded by this Healthy Futures Fund and the rest of the budget, we want to make sure that is a reliable source.
Yes, Senator, but I think Jason may be able to give you some insight on that one.
Sure, Jason.
Hi, Senator. So in the beginning of FY19, if you notice, the October and November collections are lower than the average for the rest of the fiscal year. So I think it just took a couple months to get the new taxes collected. So it should pick up to where it needs to be in 2020.
Thank you. That's a very rational explanation. I appreciate that.
No
Thank
problem.
you. And Mr. Chair, I was also just trying to follow the recycling revolving fund. If I don't know, the amount seems so low, but this is what we traditionally bring in is only $2 million on the recycling revolving. Two, three, two, four. Yes, I guess this is about $400,000 more than 2019 collections so far.
You're referring to the 2019 tracking? Or your
Yes.
2019 appropriation level?
Well, I don't see the appropriation level on this report. Do you have it? Yeah. What is the 2019?
The appropriation level for 2019 is 2.895.
Oh, so it's the same.
It's almost the same.
Okay, yeah, so that's my question. What is it, why are we remaining flat with that fund?
There's some funds, Senator, that, historically, if you look over the period of years, maybe 2, 3, 4 years, some funds just don't grow. They just remain status quo. And unless there's something that we know that will trigger an increase in the collection, either increase in fines, increase in fees, a lot of these funds just normally stay status quo. So, for what we do is, like I said, I'm always more on the conservative side. I like to just keep it either status quo or grow it maybe 0.5% if there's reason and cause for us to do it. But other than that, we just normally keep it at a status quo level.
All right. For these funds that are listed here, do you think the budget has any provisions that would help to increase collections on these funds? For example, this recycling revolving fund?
Senator, we've been working with several departments and agencies about seeing how we can basically increase revenue collection on various funds. They have come back to us. We've actually sat a couple of times with some of the agencies, customs, agriculture, places like that. And there is talk about maybe trying to revisit their fee structures, their fee schedules, and maybe, hate to use the word, but they're looking at maybe making some adjustments in these fees. And if those meetings are fruitful and we can come up with actually adjusted fee schedules, then maybe those are the times we can actually increase these revenue funds.
All right, well, I was hoping that wasn't the answer. I'm looking more towards enforcement, increased enforcement, like we're giving them more employees or more something in this budget so they can increase enforcement as opposed to increasing fees or something like
You
that.
know, Senator, that is one of the things that I believe Department of Agriculture is doing with the invasive species funds. They're actually out there being more aggressive, going out there and doing these checks and validations of what's actually happening out there. I think the importation of containers and stuff like that, they're actually vigilantly going out to the port and inspecting these things, unlike in the past, we're not as aggressive to do that. So we expect an increase, at least in the invasive species fund with Department of Agriculture. And to your cause, yeah, that doesn't include a increase in fees. It was just more or less just beefing up operations.
Thank you. Thank you, Mr. Chair.
Thank you. Now we'll go back to Senator Muñoz, because I know you gave out your handout. Ma'am?
Yeah, thank you, Mr. Chair. Now, I know we're on revenues, but if the body would please indulge me just for a few minutes, just to remind them, because this is in regards to line 6, Healthy Futures Fund, letter Q, the $41,517,022. Before everyone starts getting excited that we've got all this money in there and that we can appropriate it to many different places, I just want the body to just maybe to remind them, if they don't know yet, just to take a look at, I passed out a current law that we have, 11 GCA Chapter 26, Article 6, and I just want to just reiterate a few things in that law before we start talking about the revenue. On letter E, creation of the Guam Cancer Trust Fund, hereby created by the Guam Cancer Trust Fund, which shall be used to provide financial assistance to organizations to provide patient-directed services for the prevention of cancers, its treatment, diagnosis, and other services that may be required to access treatment, including but not limited to off-island transportation and temporary housing. And I'll just go really quickly into the number 2. The Guam Cancer Trust Fund shall be subject to the following. A, 15% of the Healthy Futures Fund into the Guam Cancer Trust Fund, which shall be held in an account at the Guam Financial Institution, separate and apart from all other accounts and funds of the government of Guam, and shall not be subject to the transfer of the authority of Megalahan, Guahan. I just want to point that out before we start talking about the revenues. And then the other sheet that I passed out is actually the history of the Healthy Future Fund appropriations to the Guam Cancer Trust Fund in the last 5 years, to also include what's appropriated here for Bill 186. But let's start at the year 2015. Mr. Chair, the Healthy Futures Fund revenue was at 16.2. We appropriated 2.2 million, a little more than 2.2 million. And that was as close to 15% as we ever gotten, 14%. Now, if you look at the year 2016, the revenues from the Healthy Futures Fund was at 23.893. We appropriated 2.86, and that's at 12%. We were still short, even at 12%. In 2017, the revenues was $23,175,909. We appropriated $2.781 million there, and that was only at 12%. In 2018, the Healthy Future Fund revenues was at $27.862695. We appropriated $2,786,270. That's only 10%. In 2019, Mr. Chair, Healthy Futures Fund revenue was projected at 41,419,667, and we gave them zero, nothing, 0%. And now in this bill, Mr. Chair, for 186, we're projecting about 41,500,000 again, and we're only appropriating 1 million. That's only 2.41%. Now, I just want everyone, I know we have enough paper already all around our desks, but I just want everyone just to be mindful of the history of the Healthy Futures Fund and the current law that we have in here, and just putting a notwithstanding clause on this current law doesn't make it excusable. So my question, Mr. Chair, for the revenues, is the change in the Healthy Futures Fund revenues. I know one of my other colleagues asked this question. From the original Bill 186 to the amended Bill 186. The original bill forecasted revenues at $37,692,781, and now it's at $41,517,022. That's an increase of $3,824,241. Now, Mr. Chair, if you can just answer me, how did we decide to spend this extra money? And if you can explain where we appropriated the extra $3,824,000 Healthy Future Fund that you added to this bill. I know you've been trying to work with us really closely, right? So I have been actually going through the bill and looking for where this extra money went to. And if I can, please, since we're still on revenues, I really would like an itemized breakdown of where the appropriated additional $3.824 million, in case I may want to direct some of this money back to the Guam Cancer Trust Fund where it belongs.
Yes. Steve? Steve will explain that.
The increase that we did in the Healthy Future Fund, the additional, I think, $4 million actually was allocated to the health agencies, GMH, Public Health, in particular Medicaid and MIP, and also with the hospital. So any increase that we did in the Healthy Future Fund went directly to health-related programs. It didn't go anywhere else other than health-related agencies.
Okay, so can you just provide me with a breakdown of that? I mean, is there a way that we can do that where I can see exactly where, specifically from the Healthy Futures Fund, if we can do that? Because I don't want to make anyone seem like they're less of a priority than the Guam Cancer Trust Fund, because health-wise, across the board, everything is a priority. But by law, Mr. Chair, yeah, you know, we have an obligation and a commitment like we did to the Guam Cancer Trust Fund to at least abide by it, in which in the last, if you can see, last 5 years, even up to this year, we have never lived up to that commitment. So if I can just get a breakdown and see.
We'll provide that.
Okay. And then I would also, once we get to the appropriation part, I'll dive a little bit more into it and see how we can adjust some of those figures. Thank you, Mr. Chair.
Thank you, Senator Munoz. Does any of my colleagues have any questions they wanted to ask? Senator Tello.
Mr. Chair, can I take a real quick minute recess, please?
Let me move on to another colleague. Vice Speaker, Senator Nelson, before we go to recess. Vice Speaker Nelson.
Thank you, Mr. Chair. Perhaps we can continue moving along, and while I'm speaking, whatever needed to be done for recess would be done. I want to thank the previous speaker for bringing this issue of the Healthy Futures Fund up. But my question really is, when we move this money into the Guam Cancer Trust Fund, how is this money spent? And where is it spent? And does it go back to those that are suffering from cancer, or is it used to pay an inflated business cost that perhaps the government contracts out? And that's my concern, because if it's used for the travel for those that are suffering from cancer to seek treatment elsewhere outside of Guam, then that's great. But last year, when we took a look at this money that was used for a certain business that is contracted through the government to provide services to those that perhaps go to the Philippines, or Taiwan is a new location, or Hawaii, to receive some assistance there by the government contract for that specific business, many of the people were dissatisfied, even in LA. They felt that the needs that should have been provided with this business was neglected. And so I want to ensure that if we are addressing this issue of the Healthy Futures Fund being used as a way to subsidize the Guam Cancer Trust Fund, I think we should also take a look at if we are contracting a business out there to provide these services in other states and other locations, how they spend that money as well. Because truly, when we asked for real documentation last term, what we got was an Excel spreadsheet of estimated numbers. And we don't do estimations if you are a business trying to stay afloat. You do accurate numbers. This is not the budget where we do projections and so forth. It's the accountability of how the money was spent was lacking. So if we're going to really go, if we're really concerned about this, I feel that we need to address this issue as well, because this is the underlying sickness of the matter, is the money is not being spent really to service the people that need the care. It's an inflated cost that they charge the government of Guam. And we need to take a look at that and hold those accountable for that money, that inflated cost. Thank you, Mr. Chair.
Thank you, Vice Speaker. I would recommend that when we get to those agencies, that we can ask the oversight chair, and if need be, we'll even ask the agency to come in and explain that. So that as my colleagues wanted to shift the funding from where they're at, that's the means of identifying that funding. Do we have any other questions? Senator Tello.
Thank you, Mr. Chair. It might have been asked already about the excess funds for the Healthy Futures Funds account for FY19. And the projected revenues, as you mentioned earlier for FY 2020, is based on those from last year, what we're tracking. So the question is, if there's excess FY19 that are already tracking excess revenue, where is that money going to? In other words, okay, maybe I'll explain it again. So we are tracking excess revenue for the Healthy Futures Fund for FY 2019. So, well, I guess first maybe you might want to ask that, if I'm correct on that perspective, and then what are you doing with that excess funding? Are you incorporated into the Healthy Futures Fund for 2020, or?
No, Senator. 2020 revenues are strictly revenues that are going to be generated in 2020. Whatever excess revenues are realized in fiscal year 2019 will stay in the fund. And if there is actual excess, those funds would have to be appropriated.
Is there any excess showing right now, tracking in the Healthy Futures Fund for FY19?
Hi, Senator. The July Special Fund report that was transmitted is showing a shortfall of 1.3 million in FY19, which is due to the tax taking a few months to actually get off the ground, the increased Healthy Futures tax. If you look at the July Special Fund report, it shows a 1.5 million collection in October and 1.9 in November, but the remaining months are in the 3 million, 4 million range. So it took a couple months to catch up. So it's not tracking in excess in 19 currently.
Okay, thank you so much.
Do you have any other questions from my colleagues? On page 4? No other questions? If there, Vice Speaker, ma'am?
Since we are talking about, we brought up the Healthy Future Fund, there was a statement made a while back that said that as of November 2017, that the Healthy Futures Fund had over $4 million within DOA. Is DOA still tracking that money? Do you just hold on to this money? Where is this at now? Did the money be used for something?
The Healthy Futures Fund, like all special funds, is a continuing fund. So the balance at any point in time, at the end of any financial year gets carried over to the following financial year. So when you're looking at the financial statements, that is the tracking.
Well, I'm asking you right now, because is there a number amount that you're holding on the Healthy Futures Fund since 2017 is basically what I'm asking.
I'm not sure I can answer the question in the way you're asking it. Each year, there's a balance carried forward, just like a bank account.
But the money rolls over, doesn't it? If you don't spend it within that fiscal year, that money rolls over.
The money rolls over. But
at the end of fiscal year 2017, how much was in the balance at the end of the fiscal year for the Healthy Futures Fund?
That's what I can't answer. What was in 17 got carried over to 18. Some of that was spent in 18.
Okay.
And some of it, if you recall, there was some typhoon monies that were allocated to the Healthy Futures Fund for spending. So that would have been spent in 18.
So 2017, how much carried over to 18? What's the number amount? What's the dollar amount?
I don't have the 17 numbers, but I think the balance carried over was about 6 million.
6 million?
Yes.
Okay, and how much of that was used in 2018 out of the 6 million from the Healthy Futures Fund that was carried over?
Well, I can tell you how much was spent was in 18.
I'm sorry?
I can tell you how much was spent in 18 when I look at the numbers, right?
I'm standing by.
For 18, the revenues were 32 million.
Say that again?
For 18, the revenues were 32 million and the expenditures were 28 million.
Okay, I'm sorry. So the revenue for 2018 was 32 million.
Yes, Senator.
That revenue does not include the 6 million that carried over from 17 to 18.
Yes.
Yes, it does, or no, it doesn't?
Yes, the fund balance at the end of 18 is
I'm sorry, Mr. Byrne, I'm confused. Does the 32 million include the 6 million that carried over?
Not the 32 million, the balance, the 4 million, that's the difference between the 32 and the 28, gets carried over and added to the 6 million, so the balance at the end of 18 was 10.2 million.
Okay, so at the end of FY18 was 10.2 mil. Okay, and so FY19, where are we at with that? The current tracking.
As you just heard, that the actual tracking of revenues is falling behind. So that will, whatever the shortfall, and the shortfall on year to date was higher than the tracking, but I'll ask my colleague at BBMR to talk about the tracking. So that will eat into the 10 million. So my estimate of where we're going to end up at the year end, which I think is what you're getting to, is somewhere around 3 to 4 million.
3 to 4. Okay. So that 10.2 million was spent.
I'm sorry, I didn't hear.
So the 10.2 million was already spent.
Has been either spent, yes, it's been spent.
Okay. 3 to 4 million.
Right. It's been spent either to make up for the revenues that were missing because they didn't appear, or they were allocated to the other appropriations that I spoke about just now.
And where does the money that has been set aside in the Guam Cancer Trust Fund, where does that money go?
It goes to UOG.
Okay, but you've been shorting, UOG hasn't been getting that 15%.
That is true, but we've just written to all the agencies advising them that the 15% reserves will be paid by the year end.
Okay. Thank you, Mr. Chair.
Thank you, Madam Vice. Do we have any other questions for page 4? Senator Therese.
Can you just clarify, Mr. Byrne, when you said that for FY19 there will be 3 to 4 million, are you saying you're tracking 3 to 4 million for FY19 versus this was tracking that we're going to be 1.3 million in the red?
No, Senator. I was talking about the balance in the fund,
Carrying
not the
forward
revenue.
all the other numbers.
Yes, Senator.
And part of that, Mr. Chair, we've appropriated in this bill, is that right? Some of that carry forward from the Healthy Futures balances. Thank you.
Madam Vice. Yes, ma'am.
Thank you, Mr. Chair. Just for clarity, the sake of clarity's purposes, in FY17, was there a balance in the Guam Cancer Trust Fund?
I can't answer that because I don't have that number. I can get it for you, but the whole amount gets paid to UOG for disbursement. So whether they dispersed it,
I see.
I can't tell you.
So every year, the Guam Cancer Trust Fund is given to UOG, the whole amount?
Yes.
Okay. Thank you.
Senator Paris, ma'am.
Thank you, Mr. Chair. I do have some information that might help shed some light on the question. I do have the Guam Cancer Trust Fund balance sheet for December 2018. It shows what was used. So basically, in their account as of December, they have $3,282,168.63. So initially, they started off with close to $5 million. And according to this balance sheet, they spent $361,000. So I'll provide this document for the body.
Thank you. Do we have any other questions for page 4?
Just point of information, Mr.
Yes,
Chair.
ma'am.
There's also a July 2019 report from that fund that shows it significantly less, but still over $2 million.
All right. Thank you. Any other questions for page 4? There's no other questions for page 4. We'll consider page 4 closed. We will now proceed to page 5. Do we have any questions for page 5? Senator Paris.
I just want a clarification because on page 5, it lists solid waste operation funds at $19,444,188, and on the actual on page 87, where it says Guam Solid Waste Authority, it says the operation fund is $15 million. So what is the correct number?
The difference is the debt service.
Oh, so you removed
The
the
debt
debt
service.
service?
Remember, solid waste revenues are paying for the landfill expansion. So 19 less the host community fund, less the debt service, gets you the operational amount for GSWA.
Okay. Can you provide
It's like
that?
2.999 million.
Okay.
It's
okay.
it's further back.
Okay, thank you.
Does Senator Torres, ma'am?
Thank you, Mr. Chair. I was doing a comparison on the federal matching grants and aid around line 12, item 3. And because what caught my attention was the difference, the variance in the federal matching funds between FY 2019 and 2020. And the difference is $14,520,202. So I went back and looked at it, and I noticed that many of them were status quo. Some saw some increases, like the, for example, item A, Guam Council on Arts and the Humanities was about the same. GPD was slightly higher. DICID was a little bit lower. Department of Labor was about the same. The Office of the Attorney General went up this year. Military Affairs was a little bit less, but the one item that is probably contributing to this huge decrease in federal matching grants in aid is the Department of Public Health and Social Services, where the difference between FY 2019 matching aids was, in 2019 it was $63,085,323. 2020 projected is $47,638. A decrease in $15,447,027. My and then at the university is again slightly less, or actually quite a bit less, almost 500,000. And GCC showed a little bit of a variance also. But my question is, because the federal matching grants and aid is projected to be such a huge disparity in monies, direct monies to the government of Guam, is there a corresponding effect on the public health supplement? Or, because I know with grants and aids, it's usually there's a matching component, right? Local government funds have to be put in to match certain aid that comes in from the government, and I don't know if it's 1-to-1 or what that ratio is, but can you give some comment on how we are now going to compensate for that drastic reduction in federal grants and aid for public health, and how we are going to ensure that the delivery of health services is at least consistent going forward because of our vulnerable population that this fund services?
Steve, if you can answer that one.
Thank you, Senator. Senator, just, for the federal grants and aids, remember, this number is just for informational purposes. So normally what we do is we've taken the Bureau of Budget's number that they submit in the executive branch, and we've also worked with the departments and agencies. And sometimes there's times that we have a variance in the numbers simply because of the reporting. I think what's most important that we all need to remember is that as long as we identify adequate local funds to match these federal dollars, that is the important thing that we need to do in the budget. So even if they were to receive additional federal grant monies, there's always that provision in the law that would allow these departments to utilize their local funds as local match for these federal dollars. So even though you see a decrease in the amount between 2019 and 2020, the thing that we need to keep in mind is as long as we're able to match any additional federal dollars that we may receive in 2020 to run these programs.
But based on what you're projecting in the budget, you're already anticipating that you're going to have this much less in federal programs to service the poor in Guam, right? I mean, I'm looking for a corresponding effect to this decrease or this anticipated decrease, because we understand the need to, as in MIP. Well, MIP actually is a direct Guam cost, but Medicare, Medicaid, there's always a component to matching. And so what I'm getting at is, as we look at where to shift monies, knowing that there's going to be a decrease already in federal grant monies for public health, do we also in the back of our minds need to anticipate shifting any excess monies or that way for fiscal year 2020? I'm speaking specifically to a decrease, and whether that decrease is going to amplify or translate into decreased services that we then have to anticipate picking up.
What we did, Senator, in the budget is we allocated the required local match for the federal dollars that the departments are anticipating to receive. Should there be additional dollars, federal dollars coming in the future, we hope that through the authority that we've given these departments to utilize any local funds to use as federal match, we hope that will suffice. If not, we would have to seek outside of the department for assistance for those departments that would require additional local match for federal dollars.
Yeah, I get what you're saying now. Thank you, Mr. Guerrero. But also, just one more thing. Is this also an effect of the end of Obamacare, pretty much?
I'm not too sure whether or not on the health side that's the result of, but I'm probably sure it has something to contribute to it.
Okay, thank you.
Thank you. Is there any other questions for page 5? Any other questions? There being none, page 5 is now closed. We'll now move to page 6. That, Steve, if you can just explain what page 6 is all about so that the body will understand page 6 to page 9.
Page 6 is just a continuation of sections from Chapter 1. Of course, the first item, lines 1, 2, 3, 4, and 5, is just a grand total of the summary of revenues that Guam is expected to receive in 2020. Section 3 is just the authorization and payment for tax refunds, allowing the governor to pay up to $125 million for tax refunds for fiscal year 2019. Section 4 is just a statement of revenue collection in excess of quarterly collections. It just indicates that the Bureau budget shall create a 12-month statistical revenue budget based on revenue estimates in Section 2 of this chapter, relative statistical weighting restored collection month by month. Normally, this is what we refer to as the allotment schedules for fiscal year 2020. Then also Section B, it has reporting requirements of the Department of Administration to the Legislature and to the Office of O&B. There's quarterly amounts of revenue collection pursuant to subsection A of this section on the 20th day after each quarter. Section 5 is additional child tax credit, ACTC reimbursement. This says that no less than 90% of all ACTC reimbursement received by the government of Guam shall be deposited into the Income Tax Refund Efficiency Payment Trust Fund of Chapter 5, Title 11, GCA, as it appeals to A status returns. Interest earned on funds may be used to hire seasonal employees to assist with income tax processing. Section B, no more than 10% of all AC reimbursement by the government of Guam shall be deposited into the general fund, and such fund may be expended for vacancies and overtimes for the Department of Revenue Taxation, Income Tax Processing and Tax Enforcement Division, and the Motor Vehicle Division Driver's License Vehicle Registration Insurance. Section 6 is the debt service continuing appropriations. These are appropriations made for the following debt services the government of Guam would have to pay for fiscal year 2020. Mr. Chairman, do you want me to go item by item, or is
If any of my colleagues would like to ask a question, Steve will pause per section. Otherwise, he'll just keep going. Okay, so ask the question as it relates to the section. Senator Therese, you have a question?
Yes, thank you, Mr. Chair. I'd like to make an amendment on page 6 of the bill. So, but I'm still working with legal on it. So can I just reserve to come back when that's ready? Almost ready, I hope.
Okay, you have something? Okay. Senator Torres? And then Senator Tello, you'll be right after Senator Torres. Oh, no. Okay, Senator Torres. Yes, ma'am.
Mr. Guerrero, I just had a question about the ACTC. How is that reflected on page 2, line 3, the provisions for tax refund payments? Is that net of ACTC, or is ATCC just a number that doesn't factor into the $125 million that's set aside for tax refund?
Senator, yes, that number does not reflect ACTC. So that's what is being projected to be collected. When we get an ACTC reimbursement, again, page 3 of the CRER, you'll note the ACTC reimbursements that we got, and then how that then is apportioned 90-10.
Okay, good. Thank you.
Any other questions for section 5? Ma'am, Senator Kelly Marsh,
Well, this is not just for, this is not section 5, but it's on the page. Page 6, yes. I'm just wondering about the discrepancy or the difference between OFB's denoting 63 million for the federal matching grants and aid and the governor's figure of 70.7 million, if I have that number correct.
Thank you very much, Senator. The information that we compiled for the executive budget request was in consultation with the different agencies, and as was noted earlier, there are some downward estimates on what it is that might potentially be available for federal grants requiring a local match. Our difference is actually 62, so the difference is like 4.9. For public health specifically. So to the earlier comment about would there be any potential liability for not properly identifying the totality of federal grants and then having the local match appropriately there? Well, I think when we get through the budget, whatever it is that these agencies get will be what it is that they can contribute as a local match. Mr. Guerrero mentioned that this is informational, and to a point, to an extent that's true, but there might be times during the fiscal year when a new grant opportunity comes that was not, foreseen. And I believe his comment about the agency being able to avail themselves of that grant opportunity would be contingent upon either existing appropriations and finding the local match, or coming back to the body, or seeking some assistance from the governor. So the disparity is a little different, but again, if there was an excess in public health specifically, our number is 52 million for that specific item for public health versus the 47.6. Whether or not they get 52 million or 47 million, depending on the cost share ratio, whatever public health ends up getting will be what it is that they can use to match. So therein lies the difference.
So just Masi for that, helping understand that as the previous speakers were talking about, a large part of that disparity is the difference in an estimate between the governor's estimate and OFB's, but specifically in the public health and social services.
Senator Therese, do you have get your legal write-up yet? Okay. Any other questions from any of the colleagues? Senator Paris?
Yeah, just point of information, for the debt service, is that paid first before any of the, or is that paid first before appropriations to the agencies?
What page are you on? We're on page 6?
I'm sorry, page 7.
Not yet. We're not there yet.
Right.
Once we close 6,
Okay,
then we'll be completely on 7.
thank you.
Senator Therese, you want to wait? You want to take a couple minutes, or are you ready now? Oh, you'll make copies? Okay. Does anybody else have any questions on page 6?
Sorry, point of information, Madam, point of information, Mr. Chair.
Yes,
So we
ma'am.
just received a copy of the breakdown for the Healthy Futures Fund, and I'm seeing, according to my notes, there should be something for GMH in that file. So I just appreciate if you can just double check the numbers on the breakdown.
You have a copy of it? If you can just provide it to Tom and let him make copies, and then provide all the colleagues the copies. You all got it ready? Okay. You already got it?
Yes, Senator, this is the breakdown of all Healthy Future funds in Bill 186.
If you follow the spreadsheet, OFB's proposal gave, you're just following along and just run the paper on it and you'll see what it is. But what are you asking, Senator Reese?
Well, if you look at GMH, Mr. Chair, I just want to see if Bill 186 means this version, because if so, it's giving nothing to GMH versus the OFB proposed gave 1.7.
If you look at the first column where it says Bill 18635 COR, that's the original. And then the second column, OFB proposed, that's the amended.
The current version of the
Yes.
bill. All right, thanks. Thank you.
You're welcome.
Point of inquiry, Mr.
Okay,
Chair.
Senator Therese, Senator Barris?
Yeah, so I'm looking at the bill, the current bill, 186, and on page 30, it mentions 1,729,000.
If you're gonna be beyond page 6, you're gonna have to hold off.
Yeah,
Let's
just-
finish 6 and then we move along,
Yeah,
because
and-
once we get to that point, we can settle that.
Yeah, I just want to clarify because on the handout that we got, it doesn't account for what's in the bill. So I would appreciate if you can double check the numbers.
No, Senator Barris, everything that you got on handout are the supporting documents that created the bill. But when we pass 6 and we get to page 30 or whatever page you want to discuss, then we'll discuss it. Let's not jump pages yet, because we need to close the page so we can move on. Okay, Senator Therese, you had an amendment you passed out. You wanted to speak on it, ma'am?
Yes, Mr. Chair, thank you. So my amendments on page 6 of the bill, it would be to add a new subsection C to section 4. So section 4 talks about the revenue collections in excess of the quarterly estimates and requires the report. So we've been getting these CRER reports. So what I'd like to do for 2020, Mr. Chair, by this amendment, is to actually take those excess revenues as they are reported and put them into a hospital capital improvement fund. And it's pretty much a lockbox, or I tried to make it that. It mirrors other funds, so whether they're locked or not is, subject to DOA's interpretation. But the goal was just to put it in there, subject to appropriation, and if we need to appropriate it, we do. But the reason is because obviously the hospital's capital improvement was not funded in this bill, and there's really no long-term plan for that right now. So this just saves that money so it's not spent on anything else in the interim, Mr. Chair. This is for 2020 excess, predicted, if there's any. What I did was just say, I only use the income tax and the business privilege tax, and I said for both categories combined, so that if one is short, it's not going to take any money.
Senator Teresa,
Yes.
I'm going to have to rule you out of order because we already passed the revenue part. We're now in the payment, what we're paying out. So I don't think that would be applicable at this time.
It's on section 4, Mr. Chair.
Understood. On page 6, if you look at what we're talking about, authorization for payment, revenue collect, as we just go down the line, that I understand where you're coming from.
It's
But-
pretty
but-
much an administrative thing. It's not appropriating any money, it's not paying it out, and it's not predicting it in revenue either. It's saying what they report as excess revenue at the end of every quarter is actually going to be deposited. And that's all, Mr. Chair.
Okay, let's take a couple minute break. Recess. We have returned from recess. My colleagues, we're going to go ahead and recess for lunch, and we'll return back at 1:30.